Hello everyone, let's see about the progesterone. So here we'll discuss about the uses of progesterone, focusing on 5 important topics. First, what is the role of progesterone in uterus? In uterus, if the fertilization has occurred and the fetus is formed, the baby is formed, then the role of progesterone is to maintain the endometrial lining, is to maintain the endometrial bed for the baby. So this is the endometrial bed for the baby. The baby has to be present in the endometrial tissue. So to maintain the endometrial bed, we have the progesterone. So what releases progesterone? The placenta will take over the production of progesterone after about 6 to 8 weeks. So the main role of progesterone in the uterus is in the pregnancy, it will help to maintain the bed. What about the breast? The progesterone is responsible for the structure of the mammary gland. Along with estrogen, it is responsible to maintain the structure of the mammary gland. Even in pregnancy, the progesterone that is released by the placenta will help to maintain the structure of the mammary gland. Then it has another important role in pregnancy. Any prolactin that is produced can act on the breast alveolar cells and it can cause the milk production. But the progesterone which is present throughout the pregnancy will not allow the prolactin to act on the breast alveolar cells. Therefore, it will not allow the milk production during pregnancy. The moment the placenta is removed, the fetus is delivered and the placenta is removed, the body produces milk spontaneously because there is no more progesterone in the body, and prolactin can act freely on the breast alveolar cells, producing the milk, breast alveolar cells, and therefore the milk production happens. What about the contraception? So during breastfeeding, what is the best contraception that can be given? Whether estrogen containing oral contraceptive pills or a progesterone. If the mother is taking estrogen containing pills, then estrogen, it has a side effect. It decreases the protein which is present in the breast milk. So therefore, the estrogen containing pills are not much safe. But we have something known as mini pills. Mini pills are progesterone only pills, where it will be containing progesterone but in reduced quantity. Therefore, the usual effect of progesterone is not to allow the prolactin to act on the breast alveolar cells, right? This reduced dose of progesterone will only prevent contraception, will only act as contraception, but it will allow the prolactin to act on the breast alveolar cells. Therefore, there will be no problem during lactation. Therefore, the best contraception during lactation is mini pills, that is the progesterone only pills. What is its role in body temperature? When the progesterone is increased, then it increases the body temperature. So how do we know that? What is its use? So it can be used as a method to detect ovulation. So once the ovulation has occurred, then what happens? The Graafian follicle ruptures. The estrogen production is decreased. Now the progesterone, the corpus luteum, after the Graafian follicle forms the ovum, releases the ovum, the Graafian follicle forms the corpus luteum. So this corpus luteum will now be producing the progesterone. The production of progesterone immediately after ovulation will increase the body temperature. So this increase in body temperature is by progesterone. This can be asked as a question, that's why I am repeating it again and again. So they might give you a graph and the increase in temperature can be marked with an arrow, and then they might ask you what causes the increase in temperature, and that is progesterone. So with this we have talked about an overview of progesterone. Have a good day.